My name is Graham Burns. I'm a consultant respiratory physician. I've worked in the NHS for over 30 years.
My name is Karen Marshall. I'm a specialist respiratory nurse consultant. I'm also trained in Cognitive Behavioral Therapy, or CBT for short.
Working together, we've spent our careers looking after patients with lung diseases, such as COPD, asthma, and lung fibrosis.
We've also seen the devastating psychological impact that chronic breathlessness can have on a person.
We'd like to tell you about BreathTec, a personalised, interactive course of treatment for any patient limited by breathlessness.
Living with breathlessness from any cause can be difficult and can have a major impact on quality of life. Breathlessness is not just unpleasant, it can be frightening. It can lead to symptoms of anxiety and depression.
To improve quality of life, the best care not only addresses the lung disease, but also the psychological impact of the condition.
BreathTec focuses on important areas such as breathlessness, physical activity and mental health.
In 2018, we published our research in a high-profile international journal of respiratory medicine. This not only revealed the extent of the problem, but also demonstrated the enormous benefit of using a cognitive behavioral therapy approach. BreathTec harnesses decades of clinical experience and scientific research on the management of the psychological consequences of chronic breathlessness.
CBT not only reduced the frightening symptoms of breathlessness and anxiety in a clinically meaningful way, it also had an enormous impact on healthcare utilisation.
Those receiving CBT had 41% fewer hospital admissions. A&E attendances were better than halved. So this is one of those rare interventions that is not only good for the patients, it also saves the NHS money.
Thanks to this work, CBT is now recognised as an integral part of COPD management in national and international guidelines. The problem is, there just aren't enough therapists to deliver it at the scale required.
That's why we've created BreathTec. It translates the entire programme of treatment into an online course of CBT therapy. The course of treatment is delivered in 5 sessions. It's interactive and bespoke to the individual patient, depending on their circumstances and needs. Sessions include
a specialised assessment with progress reviews and feedback,
information about the patient's specific lung condition from expert authoritative sources such as Asthma and Lung UK, Action for Pulmonary Fibrosis and the NHS.
Advice on aspects of self-management such as smoking cessation, inhaler use and weight management.
Practical tips on managing breathlessness.
Simple explanations of the link between breathlessness and anxiety.
Tips and techniques on how to break the anxiety cycle.
We give guidance on staying active no matter what the patient's limitation, using tools such as an activity diary, a step count and automatic reminders.
We explain how to recognise and understand mood and what to do to lift it.
There are tips on managing stress such as learning to relax, mindfulness, staying connected and the importance of social contact.
Patients are awarded a certificate when they've completed the course. And finally, BreathTec uses ReciteMe, an award-winning web-based accessibility toolbar that allows users to customise the programme in a way that works for them. For example, it can change the language or even read the page for them.